There are no disclosures other than I am a member of the Academy of Pediatrics as well, to note that, and the Academy is one who helped develop the toolkit, and thanks to Dr. Al-Yamani and others who helped get this translated. It's very exciting to pull this out of English. It's been translated into Spanish, and Arabic's very exciting. The goals of my talk are first to discuss the context of systems for care, children, families, and providers. Second, to describe challenges in effective recognition and diagnosis of ADHD, which you may know fairly well. Third, to share some strategies to implement guidelines using the AAP toolkit. And fourth, to consider how these principles can apply to your own practices and cases. And I think that's the part I'm excited about in the next workshop, to make it a little more interactive, to say, how might this work? What's your current practice? What would work? What would not work? How do you adapt this? As an overview, I'm going to go through just a little bit of background literature and science as well, introduce you to the toolkit briefly, consider some issues, and set the stage for the afternoon workshop. This is a big, busy slide, but just to say there are many systems involved here, and I think hopefully we have physicians at the hub coordinating things from school, from parents, from social services, from mental health, and I think our job is to pull all of these things together, and we can all be catalysts in this area. This is quite another busy slide, and it's intentionally busy to show that these red drops show that there's fallout at every step of the way. To provide good care from presentation to a child that goes off to college functioning well, there's a lot of steps in between, and I think our families can fall through the cracks at every level. So our job is to help engage people once they come to your office and say, I'm concerned about this issue. How do we make sure that we collect information on diagnosis, coordinate input from schools, have them come back for evaluation, set up a treatment plan, come back and titrate their treatment plan, maintain long-term therapy. You've already heard some data that a lot of families we know will drop out, not come back for a visit, not fill out forms, stop taking medications. And these are all challenges for these long-term ideal outcomes. And I think that's something in medicine we sometimes don't do as well. If it's an appendicitis, you take out the appendix, you're done, you feel good about it. Chronic care is a lot more challenging. I think that's what we're talking, building systems to support that. Current practice, as I've said, the complex system has many pitfalls. There's really wide variations in ADHD care. I'm sure that's true within the region here. I'm going to present some data from the States. Even a very local school level, you'll see wide variations in treatment practices and diagnostic practices. I think pediatrics is often not equipped to provide longitudinal care, as I said, and it really does demand a team approach and coordination across the systems, as some of the literature below has shown. This is some work we did in Michigan, and the geography is not important, but just if you look at the black and gray bars and white bars, it forms this patchwork quilt. This was looking at, in our Blue Cross insured system across the state of Michigan, how many children were on a stimulant. The dark black is 10 to 12%, the white boxes are 0 to 2%. And you can imagine the population is fairly homogeneous, so prevalence should be pretty similar. But you can see due to different diagnostic practices, that results in different treatment practices. And there's probably some over-treatment and probably some under-treatment. But I think we're trying to be guideline and evidence-based to even that out as well. But I think it's very striking that we have this in the States, as well as I'm sure lots of region, that the care is really variable. Our goal is to raise the bar so it's a lot more consistent. So that's why I'm glad you're here, to learn about these things and hopefully provide care that's more consistent and quality. The majority of the U.S. used the guidelines, I think, was an attempt by a lot of very bright people through the Academy of Pediatrics. This was published actually in 2000 and 2001, the guidelines on diagnosis and treatment. American Academy of Child Psychiatry came out in 2007 with guidelines that I think are helpful to refer you to. But the guidelines gave us a roadmap to work from, and then the toolkit and some of the dissemination helped move us from there. And I think that's where we can maybe go in other areas, and we're hopeful to share that information and experience that we have. Unfortunately, as you know, physician practice is hard. We all think we know what's best. We develop our own systems. You get comfortable using that. So very few physicians we found used all of the recommended concepts, still less than a quarter maybe. We are doing probably a better job in diagnostic methods, largely because of the toolkit, which is very easy to use. So I think that's certainly helped in diagnosis. Treatment is still somewhat variable as well, and I think the follow-up and especially documentation, we're not quite as good about writing out and following up. So I think these scoring systems are useful for that regard as well.